Medication, is that considered the first line of treatment for patients, or where do they fit in?
Usually we use medications to start the treatment once that we have the diagnosis of epilepsy. There are different types of medications. There are many medications in the market right now, and we try to address which one is the best medication according to the patient. Every patient has different characteristics.
Sure.
Woman or man, are you going to become pregnant in the future? What medications? Do you have other medical conditions? So we look into all of those, and then we'll see what is the best fit from the medication perspective. However, this is an integral plan that we need to do. We need to look also at the situation of the patient. What does the patient do? Where do they work? What is the best schedule? Sometimes I have patients that come and they work at nighttime and then they have few sleep. So I have to tell them, look, this is not only about medications, but it's about you taking care of yourself and using common sense. You know, sometimes they have to stop doing certain activities that, if they were going to have a seizure, will be putting themselves at risk or someone else around at risk. So I tell them, use common sense. Let's do an integral plan, and you have to look at different things, not only medications.
Sure, like you said, medication, lifestyle factors may
Right.
play in. And again, it sounds like, and with a lot of other conditions as well, could there be some trial and error when it comes to what medication may work for someone, but maybe you have to switch because it's either not working or are there some side effects?
So it's important to say that medications work in about 50% of the cases, the first medication. So there is a chance that the first medication doesn't work. Basically, you have 1 out of 2. That doesn't sound very good, but nevertheless, it's the first step. Sometimes adding a second medication can help to 70 or 80% of seizure control.
Okay.
However, after adding or changing to the second medication, the likelihood of controlling seizures decreases. And sometimes I have patients that are completely refractory to medications, or they are resistant to medications. And that's when we have the term medically refractory epilepsy. When you have failed 2 or more medications, it's considered refractory. Now, these have been to be chosen appropriately for epilepsy, because sometimes some medications do not work for certain types of epilepsy, or some medications can actually make worse epilepsies.